Hi, everyone, and welcome back to another episode of Mindful Marathon Conversations. I'm your host, Dr. Michelle Quirk. I'm a pediatrician and a run coach and the founder of Mindful Marathon, where I help make running easy and fun for busy professionals. And today I have a very special guest with me. I have Dr. Nabila Noor with me. She is an OBGYN. Dr. Nabila, welcome to the show. Thank you for being here.
Thank you. Very excited to be here. Thank you so much, Dr. Quirk, for having me.
Yeah, and we have a very exciting topic for everyone. But before we get into that, Dr. Noor, will you introduce yourself a little bit to our audience and let everyone know who you are and what you do?
Yes, of course. So as you mentioned, my name is Dr. Nabila Noor. I'm currently practicing in the Lehigh Valley area in Allentown, Pennsylvania. So yes, my background is in obstetrics and gynecology, but I am fellowship trained and board certified in urogynecology, which is essentially a subspecialty of obstetrics and gynecology. And as a result of my specialization, primarily now, I take care of women suffering from various kinds of pelvic floor disorders. Now, the question always comes up, what do you mean by pelvic floor disorders? Because it's a relatively new field. So I primarily take care of women with urinary leakage, bowel leakage, pelvic organ prolapse. So these are some of the things that I take care of, as well as some non-surgical things. For example, recurrent urinary tract infections, as well as some, reconstructive kind of work, like, women with vaginal cysts or vulvar cysts, or, there's periurethral cysts, things like urethral reticulum, fistulas. So it kind of keeps it very interesting because I see a whole gamut of patients, anywhere in the age range from their early 20s all the way to 90s. And then, like I mentioned, I do see a lot of interesting pathology, which keeps my job very interesting.
Yeah. That is a wide range of things for sure. And as you were talking, I just keep thinking in the back of my mind that this is something that we don't talk about a lot, especially as women. And one of the reasons I wanted to have you come on the show is to talk about what you do and also to help all of my runners out there who have some pesky problems. That is what I will call them. Pesky problems that are coming up for them. Maybe may I just share a story from what I have heard from my runners, and then we can go from there.
Yeah,
So I've
yeah.
had runners ask me a big problem for us is finding bathrooms en route. So whether we have a urinary leakage problem or not, we always want to know where the bathrooms are. But this is an especially big problem for runners who have urinary leakage. So maybe could you speak to that a little bit and then help us
Yeah,
to fix it?
absolutely. And it's a very common topic, right? I mean, urinary leakage, believe it or not, 1 in 2 women at some point in their life will be suffering from it. And like you mentioned, it's not a topic that we talk about. And traditionally people always thought that this is only something that happens in elderly women or women as they go through menopause. But now that we're having more conversations, we're learning, and I see it all the time in my office, because even women as young as in their 20s and 30s from pregnancy or childbirth can have urinary leakage. And then as they progress through the different decades of life, things can evolve, get worse, and there are different kinds of leakage. So I think just starting with what are the different kinds of urinary leakage, right?
Mhm.
So when we talk about urinary leakage, there are two big categories. So the first one is what we call stress urinary incontinence. So stress urinary incontinence is basically leakage with any kind of physical activity. So these are my patients who will say that, when they're running, they leak, or when they're exercising or jumping on the trampoline, or even laughing, coughing, sneezing, anything where they're bearing down that puts pressure on their abdomen and that causes pressure on the bladder causes them to leak. So that's one. And then I think what you're alluding to, probably your patients who have overactive bladder. So
Mhm.
these are women who feel like when that urgency hits, they gotta go, because they can't hold it, right? Or else they're gonna have an accident. A
Mhm.
lot of them are going to the bathroom a lot, so something we call urinary frequency. So they're going more than 7 times. Like I have patients who say they're going to the bathroom every hour, if not every half an hour. Then there is something called nocturia. So these are women who wake up at night to go to the bathroom. So as you can imagine, they're not being able to get a good night's sleep. So they're exhausted the next day and leakage associated with that. So all those, the urgency, the frequency, the nocturia, and the urgency related leakage in combination, we call that overactive bladder. And a lot of my patients, and in fact, a lot of women will have something called mixed incontinence. So
Mhm.
that's where they have a little bit of stress incontinence, but they also have the overactive bladder. And the reason it's important to differentiate is because the treatments are very different. Because
Okay.
stress incontinence, that's more of an anatomical issue. So when we're talking about treatment, we're talking about something very different. So these are the women you talk about a sling. Whereas, with overactive bladder, when we're talking about procedures, we're talking about more like bladder Botox, or, there's a
Oh,
stimulator, something called a sacral neuromodulation. The good news is both of these can be treated conservatively, and that's where pelvic floor exercises. I know we talk a lot about that. Pelvic
yeah.
floor exercises can be really helpful, but that's kind of the big breakdown of the different kinds of urinary incontinence.
Wow. Okay, thank you. I feel like we just got a whole master class and I didn't know about bladder Botox. So that
Yes.
this is amazing though. Okay.
Yeah.
So I think, I mean, one of the things as you're talking, I feel like part of this is that we as women and runners maybe aren't talking about it. And because of that, see, I didn't know that all of these wonderful things existed to be able to treat it. And so I feel like at least having this conversation, I want everybody out there listening to know that you're not alone, first of all. And second of all, these things we can help you if you find the right person. So
Oh, absolutely. And I think, like what you and I were talking about before, right? Like so many
Mhm.
women, they want to be physically active, they want to pick up running, and, they enjoy running because it really allows you to be outdoors and you enjoy the beautiful weather. But, I hear this all the time in my office, right? Like women come to my office and the first thing they say is that my bladder is dictating my life, right? Like the bladder decides what I can do and what I cannot do, right? I mean, imagine, your clients that you work with that, who wants to run a marathon and they're really excited, they're really motivated, but they're so anxious and petrified that what if in the middle of a run or in the middle of a practice, I have to run somewhere and I may not have a bathroom and I may have an accident and wet my underwear or worse, like wet my pants, right? It's embarrassing and these are real problems. Something
Mhm.
I always tell my patients, these are not things that's life-threatening, but the amount of psychosocial impact it can have on patients are isolating themselves, they're not doing things they're enjoying. These are not things that they feel comfortable sharing with their family or even their partners. It affects their relationship with their family because they don't want to go outside with everybody else because they're feeling guilty that they have to tell everyone to stop every hour on a road trip. So these are real things, and to me that's why like I love what I do, because there are so many amazing options that we can
Mhm.
offer patients in today's world. And a lot of these were developed pretty much in the late 90s. So,
Mhm.
and with every year, things are progressing. So I feel very strongly about educating patients, the general public about all these different options because patients may not even know that these new technologies exist. And most of the procedures are minimally invasive, which means patients just come in and out and they're home and they're just going about their life. It's amazing.
Yeah, yeah. And I never want this to be a reason why a runner tells me like I don't think like I really want to be able to run a half marathon or a marathon, but I can't because of this. Like I definitely don't want that to even be on the list.
Absolutely. And I think, if there's one thing that I want, your audience to take from here is even if you don't remember the details of everything, is that if this is a problem that you're having, and we actually didn't even talk about some women who may be suffering from bowel leakage, because just with like urinary urgency, I have some patients who have what we called fecal incontinence or anal incontinence. So those are
Yeah.
women who have an involuntary loss of stool or have an accidental loss of bowel and not be able to control it, right?
Hmm.
And
Hmm.
so whether it's your urine leakage, whether it's bowel leakage, it's first of all, it's more common than you know.
Yeah.
With urinary leakage that we talked about, 1 in 2 women at some point will have it. And for fecal incontinence, 1 in 12 adults actually
Wow.
have fecal incontinence. And again, these are such sensitive topics. We don't really talk about them, but that doesn't mean that it doesn't exist. And most importantly, it doesn't mean that there's no help. And yes, it can happen, but it's never normal to leak urine, to leak stool, and worse, like, stopping yourself from enjoying the things that you want to do because you think, this is limiting you in some way.
Yeah, yeah, no, I think that's a really important point. One thing we were chatting about before I hit record was my personal question, which is, can these issues affect you whether or not you have had vaginal delivery, have had a child, and we delved into that a little bit, but I was wondering if you could share that your response, because I think that will help so many also.
Yeah, absolutely. And that's a great point that you bring up because, often we don't think about, okay, this could happen to a young person, right? But we do know pregnancy is a risk factor. We do know that, childbirth, especially vaginal delivery, that may be traumatic. And what I mean by that is, maybe a vaginal delivery that required the use of forceps or vacuum to get the baby out, or somewhere where the OBGYN had to do an artificial cut, something we called an episiotomy, because with those, you can have a lot of trauma to the pelvic floor. So our pelvic floor is essentially a group of muscles and connective tissue that forms the base of our body. And that's what's helping support all our pelvic organs. So that includes the uterus, the bladder, the rectum, the intestines. And a lot of the times, weakening of these pelvic floor muscles can affect, down the line, whether or not women develop urinary incontinence, bowel issues, or even something called pelvic organ prolapse, where the organs are essentially pushing through. So to your point, is pregnancy is not having children 100% protective. And unfortunately, it's not, right? Because there's so many risk factors that could
Yeah.
be causing it. Pregnancy is just one risk factor. Mode of delivery is just one risk factor. The alternate of that question I get is like, oh, I had a C-section. Why am I still leaking urine? And again, mode of delivery is just one risk factor, right? There are other risk factors such as age, genetics, chronic constipation, chronic cough, because anything that puts that constant
Mm,
pressure, being
yeah.
overweight, right? Because again,
Yeah.
that puts a lot of pressure on your pelvic floor muscles. So it's not just one thing. Of course, if there are factors that you can avoid, it will be helpful. So, when patients come to me and talk about like, oh, should I have a C-section and will that be 100% protective and prevent leakage of urine? The answer is it's not so simple. So I think each individual's patient's story is different. Each patient's risk factors are different. So if this is something that maybe you or your clients are considering about, what can I do as I'm getting pregnant or thinking about pregnancy to help prevent it for the future? Or I'm pregnant, I'm thinking about mode of delivery,
Mhm.
should I consider an elective C-section versus a vaginal delivery? These are amazing conversations to have firstly with your OBGYN, and then if needed, get a referral to see a specialist like myself, a urogynecologist who have experience dealing with these topics, and we can have a more one-on-one individualized conversation.
Yeah, yeah. I guess the takeaway there is like it's multifactorial, right?
Yes,
there's
yes,
different risk factors. Everyone is different, and yeah, yeah,
absolutely.
yeah.
Yes.
Do you think that or well, should all of us be doing Kegel exercises?
Honestly, I would recommend anybody. Like, it's just like any
Okay.
other form of exercises, right?
Yeah,
Should you be working out in the gym? You should be doing some sort of physical activity. And if you're talking about improving your pelvic floor muscle strength, then yes, Kegels are amazing, right?
yeah,
The problem that I see sometimes happen is that, I have patients who come to me or friends who tell me, oh, I'm doing my Kegels, and they're very excited. And when I actually go to evaluate them for their Kegel strength, I'm like, you're isolating the right muscles. And we're laughing about it, but it's hard, right?
yeah,
Because
yeah.
it's not like your ab muscles or your biceps that you can see. It's
Right.
inside the body. So it's a little bit like abstract. Be like, how do I even know? So what I tell patients, especially when they come to the office, right? It's essentially when you're starting off, I think the easiest thing to do is doing it while you're laying down, right? So then that way you can kind of really concentrate. I tell them, put your hand on your belly, right? When you're contracting your pelvic floor muscles, you shouldn't feel any
Mm.
tightness on your belly. And similarly, you shouldn't be using your thigh muscles or your glute muscles to
Yeah,
lift
yeah.
up your pelvis, because that's what majority of the patients do, right? The
Oh,
idea
okay.
is to just use your vaginal muscles. And if you're comfortable, I'll have patients like when I'm doing it in the office, I'll put two fingers in the vagina and I'll tell them to do their best Kegel, and I should feel that squeezing around my fingers. If I'm not feeling that squeeze, then they're not doing it right, or that there's room for improvement, right?
Hmm. Hmm.
So that's when working with a pelvic floor physical therapist can be really helpful. It's just like working out with a coach, right? They
Yeah,
can kind of guide you a little bit, make sure that you're isolating the right muscles, but after that, the onus is on the patient or the person who's doing it, right? It's just like working out in the gym. You can have the best trainer, but if
yeah.
you're not going to put in the hours and the effort, it's not going to work and you're not going to see the benefits. So I usually tell patients start with doing 2 or 3 sets of repetitions every day, right? The first 15 can be quick, like you just basically contract and you relax. Relaxing is very important because what happens is if you're just tightening those muscles and not relaxing it, women like subsequently can develop something called myofascial pain syndrome. And so because those muscles are always so contracted and not relaxed
Makes
enough,
sense.
and then they
Yep.
end up with a different problem altogether, which is a whole other conversation, right? So, basically like contracting your muscles and relaxing, very important. And again, the idea is to build up that strength so that, when you're contracting it, when you started with simple 1 second contractions, but eventually try to build it up. See if you can hold it for 5 seconds, hold it for 10 seconds. So that's how you kind of build up the strength.
Wow. Yeah. Okay. I feel like now I have, in addition to like the run training and strength training plan, we have to work this plan in there too.
Absolutely. And honestly, like I tell patients, there's no harm in doing pelvic floor
Yeah.
exercises, right?
Yeah.
Again, the important thing is doing it right and then also learning to relax the pelvic floor muscles. Because I've had patients, who are so proud, especially my Pilates, my
Yeah.
hardcore core exercise patients, they're so excited. They're like, oh, you know what? I do my Kegels religiously, and I believe them. But the problem is all they're doing is just tightening. They're not relaxing it. And then they end up with other issues like pelvic pain and myofascial pain, and then we kind of have to talk about myofascial release, which is basically pelvic floor relaxation.
Oh,
And,
wow.
like I said, that's a whole other
That's like the
topic of
opposite.
discussion.
Yes. Well, I think maybe, well, let's go with advice for anyone out there who is having maybe, yes, urinary leakage or fecal incontinence, these kinds of things. Step one would be maybe talk to either your primary doctor, your primary OBGYN, but perhaps get a referral to a urogynecologist, maybe. Is
Yeah,
that
I
where
would
we're at?
say, just based on my experience, a lot of young women notice it first, either with
Mm,
pregnancy or maybe, they've had, some sort of injury, whether it be from surgery or any kind of trauma. So if you're starting to notice it, if it's an isolated event because, your bladder was really full and you just didn't, urinate enough, and that's a different story. But if you're having it consistently, right, you're like, oh,
mm,
you know what, it's been happening at least 2 to 3 times a week, and you're seeing a regular pattern, you can always start with starting to do some Kegel exercises like we talked about. And, now online, there's some amazing videos, there's some amazing tips that you can do. And in fact, I'm pretty active on social media as well. So, I try to put in some educational videos for patients. So again, talking about, getting the right information, knowing what your options are. So you can start there. But yes, I 100% agree. Talk to a physician, right? Whether it be your primary care doctor or your OBGYN. And a lot of the times, if it's just basic, your primary care doctor or OBGYN can kind of evaluate you. But if you are in a neighborhood where you have access to a urogynecologist, right, it's always worth it to get a referral, even if you're not hoping to do any intervention, but at least have a conversation so you know what your specific kind of urinary incontinence is, because you may be thinking that you have stress incontinence, but it could be something else. So
mhm.
it's important to know what your options are. And then together, like for example, for me, when I see patients in the office, after I do a full like thorough history, we do a pelvic exam to rule out any anatomical factors. I go ahead and discuss all the options that we have for that person's individual situation. And then together we come up with a plan that works for them. I have patients who come and they're like, oh, Dr. Noor, I just wanted to make sure there was nothing wrong. And bye-bye, I'll see you when it gets worse. And I said, perfect, that's great. And then I have patients who are like, you know what, this is embarrassing, this is debilitating, I want this fixed. And then, we're talking about something more invasive. And then I have
Mhm.
the middle group, right? They want to be doing something more conservative. So we start with pelvic floor exercises or other therapies, and then if needed, go into something more invasive.
Yeah, yeah, no, it makes perfect sense. And I like the stepwise approach for sure.
Yeah,
Well,
for
thank you
sure.
so much. T Please tell everyone where they can find you and where they can find some of your educational videos. They're really great, everybody. You got to check them out.
Yeah, absolutely. So like I mentioned, I'm currently practicing in Allentown, Pennsylvania. So if you're in my neighborhood, by all means, look us up. I'll be happy to see you. And I am pretty active on social media. So, I have my YouTube channel. So that's Dr. Nabila Noor. And on Instagram as well as Facebook. So that's Dr. Nabila Noor. And then my website is also drnabilanoor.com. So it's all Noor, so it's easy to find. Like I said, I try to post regular videos, pretty much like on a weekly basis on my YouTube, and then Instagram, I'm putting posts almost every day. So hopefully, please log in, subscribe, and if you find it helpful, if there are things that you would like to learn about, you're more than welcome to contact me through my email on my website. And I post weekly newsletters. So yeah, so lots of ways to find me.
Yeah, and I will I'm going to leave all of your links below the video
Yes.
here
Thank
as
you.
well in YouTube. So everybody, you just click over there and follow Dr. Noor.
Perfect. Thank you so much.
Yeah, well, thank you so much for being here and for sharing your knowledge and your passion for the topic with us.
Yeah, no, thank you so much, Dr. Quirk. It was a lovely conversation. Like I said, I've always enjoyed talking about what I do, but I think, I wanted to talk to you because it's just so relevant for what you do and for what I do. And like you mentioned, I see runners in my office all the time, and nothing makes me happier than to see my patients back when they've gone through treatment and they're just like, oh my God, I can't believe I waited this long to get this done, because now they can get their life back and they can do all the fun things. And so yes, so I'm a big proponent of there's nothing normal about any of these pelvic floor issues. So let's get the conversation started. Let's get you the help that you need.
I love it. Let's end on that very positive note. Thank you so, so much.
Of course. Thank you so much for having me.
Yeah, and thanks everybody for listening, and we will catch you on the next one. Thank you so much for joining us for this episode. If you liked it, please subscribe and share it with a friend. And if you are a newer runner or a runner who hasn't run in a while and you're looking to get back into the sport, you can find out how to work with me over on my website, which is mindful-marathon.com. See you on the next episode.